Hello, everybody. And my name is Aydede, and this is a presentation for what can be predicted from a national health survey. Is cancer one of them? And we have three authors, BigSurv and myself, Aydede, and from St. Mary's, and Andrea Gusto. And all of us from the research portal on machine learning for social and health policies. I put the link over here on the PDF files. If you are interested, you can look at this research portal. This project is one of the projects that we are having in this research portal. Okay, let's start. And the motivation is very simple, and we are trying to understand whether the lifestyle and environmental factors can be identified as predictors of cancer with high-dimensional data. And it's an important question because, I mean, there's no need for detailed explanation, but basically the researchers have been trying to determine whether cancer is preventable or not. And there are basically two main factors. The cancer is caused by both internal factors like the mutation, hormones, and immune conditions. And the other factors are the environmental factors like the tobacco, diet, radiation, and infectious organisms. So usually, if you look at the literature, and the studies indicate that only 5–10% of all cancer cases are due to genetic defects, and that the remaining 90 and 95% are due to the environment and the life cycle reasons. Okay, so that's why we are trying to understand if we are going to be able to identify the environment and life cycle factors. So the uniqueness of this study is we are using the survey data, and then Canadian community, it's called Canadian Community Health Survey, which is the largest national health survey in more than 120,000 observations and annual files. And the data is unbelievable in terms of the coverage, and then we have more than 1,500 variables. And it's like we have information about the weekly calorie consumption all the way to the weekly time in minutes and spent in Olympic weightlifting workouts. So it's really rich, the survey, and but even it's very extensive health survey in Canada, it's almost useless for predictions and as well as the causal analysis due to its cross-sectional structure, because you don't know, there is one example over here. If the person is eating healthy because he or she has some health problems and all these kind of the mixed and confusing temporal relationships are basically making this survey a little bit useless. So what we have done, we're going to see that we're going to change the data, but the objective, we have two objectives, and given the data to see how tangible improvements in cross-sectional nature of the survey increases the predictive power of the data. That's one. Okay, and then the other, basically the idea is, can we use the survey for public policy, health policy recommendations? Okay, because again, it's an expensive survey, it's a very extensive survey, it's a beautiful survey, but because of the structure of the data, the survey, in most cases, it's beyond descriptive analysis. It's almost useless. The second objective is if we can discover what we call the causal predictors. It's a kind of strange the term, but I'm going to explain later. So the advanced machine learning models. Okay, so now I have to go a little bit quick, and then okay. So what we have done is we linked the survey in 2001 and the DAD data. It's called the Discharge Abstract Database. It's a kind of administrative database. And basically the linked data traces the people in 2001 for the following 10 years between 2001 and 2011. And there were people who were cancer patients in 2001 and or had gone through a cancer treatment prior to 2001. So that's why we ended up with 60,000 people who have no cancer in 2001 or prior to 2001. And we identified after 10 years, during 10 years after 2001, okay, 6,000 people who developed cancer in the following 10 years. Okay. And the first job, we said, okay, so we have amazing data. So imagine that we have 60,000 people randomly selected in the country between 12 and all the way to 90. And then we said, okay, so we can observe their lifestyle and environmental conditions and with 1,500 variables and their medical history for the next 10 years. So now, well, let's pick cancer and see if their lifestyle and environmental conditions can predict their future illnesses, and then one of them, cancer. So what we have done, okay, and with that kind of the temporal, the structure, we remove that reverse causal problem or model leaking issues. And then we created the binary, the outcome, first try to see whether cancer is a common disease. It's a kind of one cancer, okay, cancer or not, so we don't identify the type of cancer, can be predicted with non-medical data. If it can, what predictors can be identified? And we just picked between 15 and 75 because the earlier ages, the cancer incidence is very low. To give an idea about the dimension of data, is because if you have the first level interactions, the feature space increases to 100,000 features. Okay, so I said high dimensional data. Since more than 80,000, as I explained before, 80% of people between 50 and 75 is just in a cancer distribution. So that's why we picked this group. And we have 11 different major cancer types in medical records. So in our first attempt, we put them together with cancer or not, again, instead of looking at the type of cancers. And although cancer is the name given to the collection of related disease, okay, cancer is not one disease and more than 100 different types, in fact, 200 types. But again, we put all the cancer types together and we call that the person has a cancer or not in the following 10 years. Okay, and then with the binary outcome, we first try to see whether cancer is a common disease, can be predicted with non-medical data, and if can, what predictors can be identified. With our multi-stage algorithms, we could not exceed 63% of the prediction accuracy measured by area under curve. This shows that when the age is controlled, that's the age is very important, even between 55 and 75, there are very few predictors, almost like no predictors other than age. Okay, it's just a random pick basically. Even all these, the 1,500, the features, and there is no way that you can identify anything other than age that is giving you, okay, meaningful area under curve prediction accuracy. And now we move to a different practice, and then we said that we call this causal predictors. In the second step, we use two different outcomes: all cancer patients and with and without lung cancer. The results show that the first and the second hand smoking are the main predictors for respiratory cancer patients. But if they are not identified, as predictors when we exclude these cancer patients, lung cancer patients. This is what we call using prediction for causal interpretations, basically by dividing the outcome variables different ways. There's a panel data, and then we are able to identify what's causing actually what type of, or not causing what type of cancer. We know what the initial results show that smoking may not be common predictor. Okay, the remarks. The study is the first of its kind using the public survey in cancer research by developing a high-dimensional panel data set that contains more than 60,000 people and 6,000 cancer patients over 10 years. And the scope of information, even the base survey with more than 1,500 features, is unprecedented. And at this point, our initial results provide evidence about so-called life cycle style factors on cancer for the first time using high-dimensional data with unprecedented number of cancer patients. And the results are also robust and tested with more than 15 different advanced machine learning and deep learning algorithms. Although the scope of information, the survey about environmental and lifestyle, the risk factor is enormous. We cannot verify many risk factors identified in the medical literature. So it is an ongoing study. Okay, we are still working on this, but our contact information is there. So if you need to have the data scripts or the scripts for the algorithms, we would be happy to provide them. And thank you very much. Stop that.